Hi, my name is Bruce Strober. I'm a clinical professor of dermatology at Yale University, and I practice at Central Connecticut Dermatology here in Connecticut. I'll be describing the manuscript Bimekizumab Maintenance of Response through 3 years in patients with moderate to severe plaque psoriasis, results from the Be Bright open label extension trial. In addition to burdensome physical symptoms of the skin, psoriasis carries a significant detrimental effect on health related quality of life. However, efficacy demonstrated by new biologic therapies means that complete or near complete skin clearance is now an achievable treatment goal for many patients. Bimekizumab is a monoclonal IgG1 antibody that selectively inhibits IL 17F in addition to IL 17A. Dual inhibition of IL 17A and IL 17F has led to a greater reduction in inflammation in vitro and has resulted in superior clinical outcomes compared to inhibition of IL 17A alone. Here, maintenance of week 16 responses with bimekizumab treatment are reported through year 3 in patients with moderate to severe plaque psoriasis, pooled across Be Vivid, Be Ready, Be Sure phase 3 trials, and the Be Bright open label extension study. Patients included here were randomized to bimekizumab 320 milligrams every 4 weeks at baseline of the feeder studies, achieved an efficacy response of interest at week 16, continued to receive bimekizumab in the maintenance period, and enrolled in the Be Bright open label extension study. On entry into the open label extension, all patients received bimekizumab 320 milligrams every 4 weeks or every 8 weeks, depending on their treatment regimen and PASI response at the end of the feeder study. Efficacy outcomes, as shown on the screen, are reported through 3 years of bimekizumab treatment. Missing data were accounted for using modified non-responder imputation, MNRI, non-responder imputation, NRI, and observed case. Overall, patients were representative of a population with plaque psoriasis eligible for treatment with a biologic therapy. 87.5% of the 989 patients treated with bimekizumab every 4 weeks during the initial 16-week period of the feeder studies had a PASI 90 response at week 16. 693 bimekizumab treated week 16 PASI 90 responders entered the open label extension. 96.5% of these patients had achieved PASI 90 at the end of year 1 and 93% at the end of year 3 of bimekizumab treatment, as shown by the solid gray line. High levels of response were also observed in patients who received continuous bimekizumab every 8 weeks maintenance dosing, as shown by the solid blue line. 62.7% of the patients treated with bimekizumab every 4 weeks during the initial 16-week period of the feeder studies had a PASI 100 response at week 16. 503 bimekizumab treated week 16 PASI 100 responders entered the open label extension. 89.3% of these patients achieved PASI 100 at the end of year 1 and 80.8% at the end of year 3 of bimekizumab treatment. Again, high levels of response were also observed in patients who received continuous bimekizumab every 8 weeks maintenance dosing. In patients with PASI 100 response at week 16, DLQI-01 responses increased through 3 years of bimekizumab treatment, including those who received bimekizumab every 4 weeks and then every 8 weeks. At the end of year 1, 92% of the week 16 PASI 100 responders achieved DLQI-01. At the end of year 3, 89% had achieved DLQI-01. I invite you to read the full manuscript for more information on efficacy outcomes not reported in this summary video. In this long-term analysis, described in more detail in the full manuscript, the vast majority of patients who achieved disease control after 16 weeks of bimekizumab treatment maintained these responses to year 3 of bimekizumab treatment, regardless of dosing regimen. Similar results were reported in the subset of patients who received bimekizumab 320 milligrams every 4 weeks to week 16, and then every 8 weeks thereafter, an approved dosing regimen for moderate to severe psoriasis. An important improvement in DLQI-01 response, corresponding to no impact of skin disease on a patient's life, was also noted in those who achieved complete skin clearance. Uniformity in response rates observed in this analysis across all 3 imputation methods indicate the results were robust, and the impact of discontinuations and missing data was minimal. In conclusion, the data reported here indicate that long-term treatment with bimekizumab is efficacious, with additional profound benefits to health-related quality of life in patients with moderate to severe plaque psoriasis.